Good morning, everyone. I want to say hello to all the faculty at NC State and thank you for attending the town hall meeting. I hope that we're able to get to many of your questions. I know there will be more, but as Maggie said, we provided a mechanism to continue to get your questions answered and to make your concerns part of our planning going forward. You know, the past few months have been extraordinary, and I know they have been for me, and I'm sure they have been for all of you. This is unprecedented. I don't know about the rest of you, but this is my first global pandemic. And we are doing everything we can to plan, to be prepared with everyone's health and safety first and foremost on our minds, but do so in a way that continues to provide the outstanding education that NC State has come to be known for. I want to thank all of you for your amazing work and flexibility. When we had to pivot last spring to full online, it was just phenomenal what you all did in such a short period of time to ensure that our students finished out the semester and finished out safely and successfully. As we go forward, we certainly have had a lot of challenges in terms of trying to provide a mix of instructional methods to ensure that our students, when they do return to campus, can return safely. And I want to acknowledge that there have been mixed messages in all of our communications. We're working hard to make decisions that make sense for the university. And it's very clear that in the process of all of this work, that is, it's filtered through deans and department heads and to faculty, that there have been some mixed messages. But please know, at the end of the day, we're trying to work with all of you to deliver the high quality education that our students deserve and that you're in a position to deliver. I know that we're nearing the time, in fact, just a few days away from the time when we really need to lock down course delivery mechanisms so that our students can do the final registration and be confident in the way that they're going to return to campus. And I know that you're all working through your department heads and deans to get that done. To be very clear, we certainly were concerned when a large amount of our curriculum was going to be delivered online. And we wanted to encourage, as I did in a memo, as much as possible to be face-to-face, making it clear that we were trying to do that in a way that ensured the safety not only of our faculty and staff and graduate students, but our students. With that in mind, we're anxious to get everything locked down and get our students enrolled for the semester. We've made a number of decisions about policies going forward. Probably the most critical two decisions we made had to do with the academic calendar, and I want to thank Lewis Hunt and his task force for all of that work. And then finally, the biggest decision that we made as a system was the mandatory face mask, and we'll talk more about that before the end of this session. And I've had a number of questions, and I want to acknowledge this from faculty and the same with students and staff about issues around diversity and inclusion and all the efforts the university is making to be responsive to our community, to be thoughtful as a community about the work that we need to do as a university on ensuring that we are a diverse, welcoming, and successful environment for all of our students. And I want to acknowledge that while many of you had questions about some of this work, we will provide additional opportunities going forward for dialogue and conversation about diversity and inclusion as we move through the next chapter of the university. But I did want to be respectful of everyone's time and get to the issue of the day, which is a successful reopening where our university can do everything we can to protect the health and safety of our employees and the health and safety of our students. And today I'm joined by a number of cabinet members and other leaders of the university, where we want to be mindful, again, of your time and get through as many questions as possible. But before we get to questions, I want to offer Provost Arden a chance to speak to the group, and he'll be followed by Professor Hans Kellner, the chair of the Faculty Senate.
Thank you, Chancellor, and good morning, everyone, and thank you for joining us on this webinar. As the Chancellor alluded to, this has been and continues to be a very difficult and a very stressful time for all of us. When we address the issue of reopening campus in the fall, there are many, many competing needs. We know, and we are very committed to the fact that a in-person on-campus experience is a premier instructional experience for our students. That's why we work at a large, great public university, and that we're not working at an online university. We're very committed to what happens in the classroom, and we're very committed to what happens outside of the classroom to support student learning and growth. I know you join with me in that commitment. Also, we have to recognize that this pandemic is a serious threat to all of us. And so we have worked very, very hard over the summer to try to balance those competing things and design something that captures the best of a meaningful on-campus face-to-face experience while protecting the health and safety of our faculty, students, and staff to the very best of our ability. Some time ago, the Chancellor convened 10 task forces to consider the issue. Those task forces had faculty representation, including some from the Faculty Senate. And the results of those task forces were reported to Vice Chancellor Mamoni and myself, and then to the Cabinet and the Chancellor. We've published some of the results of those task force reports, but we're continuing to evolve and develop our guidelines. This is difficult work, it's stressful work, but it's incredibly important work. We know many of our students want to be on campus. We know many of our faculty, many of our staff want to be on campus, but our number one priority is still protecting health and safety. I thank you for your input. And that input, as the Chancellor has said, has often been through department heads, through deans, and many of you have also not been hesitant to let the Chancellor and I know directly your thoughts and feelings about fall 2020. And we appreciate this input, and we're looking forward to incorporating more substantial and more robust mechanisms for input as we move forward. Thank you again for your patience. Thank you for your dedication to NC State and dedication to what we do as a premier educational institution. With that, I'm going to turn it to Chair of the Faculty, Dr. Hans Kellner.
Well, Hans, there he is.
Thank you. Thank you. Thank you for the town hall and this meeting. A great deal has happened that I'm aware of in the last hour that has addressed the issues that I was going to talk about. I thank the provost, as I read in the script, for his notion of formalizing a structure for enhanced engagement. And the Chancellor has just announced that there will be such a structure meeting on a regular basis with leadership of the faculty and the staff. That said, I worry a lot that we have different views of what appropriate looks like. And well, I won't go into that now. I think it should be much more oriented to working from the start, throughout the process, transparently, and covering all issues. What we tend to get is a bit of a notification after decisions have been made, and many things come as a complete surprise. The communication has sometimes seemed like a bad Zoom meeting with weak and intermittent Wi-Fi, going from the faculty up to the chair, to the associate dean, to the associate vice provost. But the Chancellor has just spoken about that, and I think he understands very well. Faculty governance exists, As I often said, it's often a fairly routine business. But when there's a crisis, you need a faculty senate in good working order. And we have a crisis now. I want to see the faculty senate more formally engaged than it has been. I think that it will, because if the administration doesn't trust the faculty won't trust the administration back. Yes, I think we can do better in terms of the things that the chancellor and the provost have both addressed. But for the moment, I want to thank you again for what you're doing right now. My timer has quacked.
Was that what that was?
Yes,
I thought you had adopted.
Time.
Okay, good. Maggie, let's get to questions.
Sure thing, Chancellor. Our first question is about masks and enforcement. What recourse do faculty have if students refuse to wear masks in class when asked?
Well, I'll start this, and I'd like Dr. Zapata to weigh in as well. To begin with, we don't want to create an environment where wearing masks is something the police are monitoring. This is really a community standard. We are requiring it of all members of our community, and we will hold people accountable for their failure to wear a mask. So as a faculty member in a classroom, let's say you have a student that chooses not to wear a mask, you have the opportunity to ask them to put their mask on. If they refuse to put their mask on, you have every right to ask them to leave the classroom and to report the behavior to student conduct, where we want to work hard first on education, but we do have policies in place that will allow us to hold students accountable for not wearing a mask, as well as employees accountable for not wearing a mask when they're in an environment where it's required. So let me turn to Lisa and see what she would like to add to my response.
Thank you, Chancellor. You did an excellent job answering that question on the student side. We really are going to be trying to take an educational approach, whereas we will appeal to students to do the right thing, to keep our pack healthy and safe, and to wear their masks. They will be required to do so. There's going to be a rule that we're in the process of creating, and if students decide that they are going to refuse to wear a mask, then they will be subject to disciplinary action under the Code of Student Conduct. So just like Chancellor Woodson said, you have the right to ask students to wear masks in the classroom. If they don't, you can ask them to leave, and then you can also file an incident report through the Office of Student Conduct. And if you have any questions about the process, please do reach out. We are here to support you. And we also are going to be creating an opportunity for students, faculty, and staff to request special considerations regarding face coverings. And that could include accessibility or a range of other potential circumstances, but we're in the process of working on that right now, and it will be in place by the beginning of the semester.
And the only thing I would like to add to that is that, and this is an area where I really want to thank the faculty. It was really the faculty pushing hard on this issue on all of our campuses, all the universities across the UNC system, face covering, and how important it was to give them confidence and comfort in coming back to an in-person educational environment. And so this is definitely a win for the university and something I'm proud we were able to get accomplished. So Maggie, next question, please.
We have another question about face coverings. So will face shields or clear masks be available and acceptable alternatives? And when can a faculty member remove their mask for improving comprehension?
Well, this is one of the many chances I get to call on Dr. Julie Casani. For those of you that don't know Dr. Casani, she's the director of our student health centers and is a phenomenal leader in the space of public health with vast experience in this area. So we're very fortunate to have her at NC State. And with that, I'm going to turn it over to Dr. Casani.
Thank you, and good morning, everybody. So the short answer to the question is yes. Face shields and clear masks will be made available in limited quantities to the faculty. But I do want to make a couple of comments about that. So face shields are intended to be an additive layer of protection and aren't substitutes for face coverings. So this is where I get to demo. So the intent of a well-fitting face covering such as this is to minimize the spread of droplets that come out of your mouth and in your breath, and it protects others from you. Where a face shield, such as this, as you can see, is pretty leaky around the sides. So it's open and doesn't effectively capture all the droplets and aerosols, even though it's close to your mouth. So we don't have a lot of evidence about this right now, and we're working on that so that we can determine if a face shield can provide effective protection, even if we do other things with it, such as distancing and perhaps plexiglass shields. So we're working through that, and we'll be making more recommendations as that evidence becomes available. But for health and safety reasons, faculty and students have to wear face coverings when they're in class and not behind any of those other protections, and they can't stay that 6 feet away from other people. We are also looking at approved, clear, tight-fitting face masks that could be acceptable for use and might be a good option in certain circumstances, such as foreign language classes, where it's really important for the students to be able to see the instructor's mouths as they talk. But the current challenge with that is that they're not very available. There are very limited supplies, and we're working to get as many as we can related to that. We're also looking at face shields plus face coverings in certain circumstances, such as close work with students and between students and faculty, or faculty and faculty. And so we're going to be coming out with some recommendations about that. So they are on the table, we are discussing them, and we will be able to make them available in limited quantities.
Thank you. Maggie, next question.
Now I'm going to move into our next topic area, which is physical distancing. First, how was the decision made to place students 4 feet apart in classrooms? And is this consistent with health officials' guidance about physical distancing?
Let me turn it over to Dr. Hunt, but before I do, I've just recently read an article in The Lancet that maybe some others on our faculty have read about physical distancing, which was a dramatic difference from what some of the CDC guidelines had been. So I think there's still a lot of uncertainty about the amount of space, but it's somewhere between 1 meter or somewhere around 3 feet and 6 feet. So Dr. Hunt.
Thank you, Chancellor. First I want to start by thanking the Academic Calendar Task Force. They've been working very hard. I'm proud of the work we've done so far, and we'll continue until the fall arrives. We had broad faculty representation there, some experts from across the campus, and also faculty senate representation. We've been working with facilities, the University Architect's Office, Registration of Records, again, the faculty experts from across campus, whether they were on the task force or not. We started out by, our goal, of course, was safety, that the faculty, staff, and students are safe in the teaching environments, and that we allow for some face-to-face learning. We started out by crunching a lot of numbers. We tested many scenarios, and then after we did that, we walked out as a group and we looked at all the classrooms. It quickly became apparent that one size does not fit all. It depends a lot on the individual spaces, and we've made adaptations for that. Throughout the process, we've monitored guidance from the CDC, the World Health Organization, and other scholarly research. On May 14th, Bill Roper, the interim president of the UNC system, former dean of the medical school at Chapel Hill, and former director of the CDC, issued guidance saying strive to give 3 to 6 feet of space in classrooms. The paper the Chancellor just referenced came out on June 1st. It's a systematic review and meta-analysis of the use of physical distancing, face mask, and face eye protection. It's published in The Lancet. Its findings suggest that physical distancing of 1 meter or more was associated with much lower risk of infection, as was the use of face masks. Now, it does suggest that more distance is better, not a surprise. Using all this information, we settled on layering different types of protection. We're having greater than 1 meter of separation in the classrooms. We're using masks. We've installed other barriers. We're using heightened sanitation, all to reduce the risk of transmission. Thank you.
Thank you. Maggie?
As a follow-up question, for classes that require close-up instruction, such as looking at a student's screen to check work, how should faculty adjust?
I think Dr. Kasani may have addressed some of this question, but let me turn to Julie and Provost Arden and maybe Amy Orders if they have any further response to this.
Thank
Who
you,
wants to
Chancellor.
start?
I think Dr. Kasani has probably addressed this, and Lewis Hunt in his comments as well. We know that it's not always possible to maintain the optimal distance during a academic interaction, and going to compulsory face masks has really given us a lot more comfort in those closer interactions. In addition, as Dr. Kasani said, we'll be providing face shields, which are meant to be an additive to face masks. And we'll in fact be providing kits to all faculty that include personal cleaning supplies, face coverings, and face shields to go over the face mask. So I feel this combination of distancing where possible, mandatory face masks, and face shields as necessary will allow for optimal interaction. Julie, did you have anything to add to that?
No, not at this time. Thanks.
Amy, anything from your end? Dr. Amy Orders, by the way, is the Director of Emergency Management and has been very involved in all of these conversations.
Thank you, Chancellor. Good morning. So the face coverings are available now. If you are on campus during Research Restart or planning for your academic classes in the fall, they are available through Procurement and Business Services, and those faculty supply kits are hoped to be, at least by the third week of July, available as you come back for preparations and face-to-face instruction and delivery. Thank you.
Thanks, Amy. Maggie, next question.
We received several questions about testing and contact tracing on campus. What is the plan for either widespread screening or focused testing and contact tracing for students, faculty, and staff? And will there be routine screening for the community? Also, what about pooled preventive screening?
Dr. Kasani, I presume.
Yes, this is a mouthful, so let's see what we can get to. So a viral test or an antigen test, as opposed to the antibody test, can tell you if you have active infection or you're a pre-symptomatic or asymptomatic carrier. So we have been, and we will continue to do, viral testing on symptomatic students who come to Student Health Services. We also do viral testing as part of our contact tracing program. And that contact tracing program includes faculty, students, and staff who self-report that they have had close contact with someone on campus or and they themselves have tested positive. So we've had a lot of talk about testing and widespread testing, the pros, the cons, the logistics of it. And right now, as of 11:24 this morning, we aren't planning to do any widespread testing on people who don't show symptoms on campus. There's a lot of models for testing, including pooled samples, as was mentioned, surveillance clusters, and specific risk pool testing, all of which we're looking at and considering, and we're continuing to evaluate all of those options. But with regards to widespread testing, we've modeled a very good, very aggressive, actually, active testing center. And in modeling that, we realized that we could test only about 300 to 400 people per day. That's less than 1% of the campus population. And even testing at that level, it really can't be completed at anywhere near the level to be meaningful, effective, or realistic, which is why we're looking at potentially at some of the other options. But a good way, as you know, to keep the campus community safe is all of the things we've been talking about, to follow risk reduction guidelines, such as face coverings, physical distancing, to self-report if people have symptoms so that we can do the contact tracing and then cooperate with that contact tracing program, which sometimes seems challenging for some people, and so that we can go ahead and stop the potential spread. So we really rely on that self-report. And what we hope to do with that is that as people self-report, and we've done quite a few of these already, we go back and we talk to people about their diagnosis of COVID-19. So they've either been diagnosed through a test or because their provider has told them that they have it, even in the absence of testing. The person fills out a confidential online form, and that form can be found in the Protecting the PAC website and on the Student Health website, or if access isn't possible, even calling into Student Health will get you enrolled into the program. At that point, a member of the contact tracing team, who is a healthcare provider in Student Health, will work with you to identify everyone back close contacts for the past 2 days prior to the onset of symptoms. So it's the onset of symptoms plus 2 days. And that is the time period where people may be asymptomatic carriers. So these people who become your close contact, and that could be in the class or in laboratories, people that you socialize with, and even household contacts. We then reach out to them without identifying who the person is, because we don't want to create stigma. We don't want to breach medical confidentiality. We offer them guidance, and if they're NC State employees, we refer them to the NC State HR website for details about leave options. We also then recommend quarantining for 14 days, and we reach out to them every day with a follow-up questionnaire regarding symptoms and any assistance that they might need. So it truly is a 2-week close contact, if you will, with those individuals who have been identified as close contacts, right? So we do this for the NC State individuals, and we work with the Wake County Health Department on anybody who is off campus. So it's a coordinated event. So that's both the testing and the close contact program.
Thank you. Maggie?
Our next question is, what are the quarantine policies if students or faculty test positive? Is the university providing providing facilities for quarantine?
All right, Julie and Amy.
So students who are recommended to self-quarantine or to self-isolate because of illness, we're going to ask them to quarantine at home. If that's not possible, and for many students, as we learned in the spring and over the summer, it really isn't possible for them to go home, we've identified a limited number of housing options on campus. So they are away from other people with a private bathroom, and so we will be able to isolate and self-quarantine a limited number of students on campus. For faculty and staff, they're expected to self-quarantine or to self-isolate at home. And of course, we're also telling students to go ahead and notify their instructors about missing classes and missing assignments and how to make that up.
Anything to add, Amy?
We've asked the departments to consider their continuity plans for staffing models so that instructors are prepared to have coverage as well.
And Lisa, did you want to add anything on the student housing side? I think.
Well, between Avent Ferry Complex and ES King Village, we've set aside 6 buildings for a total of 166 rooms and apartments that we can use if needed.
Okay. And which, by the way, when I did the analysis or heard what others were doing, that's the largest number of the UNC system. So it's great. All right, next question, Maggie.
Thank you, Chancellor. We received several questions about building sanitation and cleaning. At the recommendation of the Faculty Senate, we're not going to spend time covering that topic in depth today. We'll follow up with faculty with information about cleaning plans for building and facilities. We're developing an extensive list of frequently asked questions that will cover many questions about how we'll manage the cleaning of classrooms, restrooms, and high-touch surfaces in buildings, as well as managing traffic flow. You should regularly check the university's Protecting the PAC website for updates there. So, our next question is whether NC State will assist in paying for testing and medical expenses related to COVID-19.
In general, for employees, the answer is no. Faculty and staff would need to utilize their own healthcare providers and insurance. Of course, testing of student health services is only conducted for faculty and staff if they're part of an NC State tracing program because of contact with an infected student or others. Most insurance carriers cover 100% of the cost of testing, and that's true for the state health plan. If you are asymptomatic and not part of a contact tracing program, most insurance carriers will not cover the cost of testing. So that's, Vice Chancellor Mamoni, anything to add to that? I think I've covered what I know about it. You're muted.
Thank you, Chancellor. No, I think you've done a great job with that list. There are the conditions for testing.
Okay, thank you, Maggie.
Our next question is about concerns around online versus in-person instruction considerations. Can you ensure that faculty members will not be required to disclose their health concerns as a prerequisite for choosing to teach online? Can you assure instructors, including graduate TAs, professional faculty, and part-time faculty, that they can request to teach online without risking retaliation?
Let me start with Provost Arden, and he may want to call on Vice Provost Schwab and also Associate Vice Chancellor Marie Williams from HR.
Thank you, Chancellor. I know that this is a very sensitive issue to many faculty, and we're trying very hard to show all consideration to faculty, graduate TAs, professional faculty, part-time faculty, regarding their needs, desires, health issues, and otherwise. In fact, to be honest, it's likely that far more online instruction will actually be provided than we would like, rather than face-to-face instruction. But it is a balance, and we're trying to accommodate faculty needs, faculty desires, and concerns, and create a premium hybrid experience for our students this fall. So first of all, your department head is the critical link in determining whether or not you'll be face-to-face or online, and sharing with your department head appropriate information and appropriate concerns is right. But we've also established a system which will be evaluated by the Office of Institutional Equity, Human Resources, and Environmental Health and Services for asking for accommodation specifically not to be in the classroom. Now, it becomes a little complicated because some of these are tied up in ADA regulations, while others are not. Nonetheless, what I can assure you is any health information shared with the Office of Institutional Equity and Diversity, Human Resources, or Environmental Health and Services will be absolutely confidential. And we have a lot of experience in doing that on a regular basis. So we are concerned about faculty needs. We're concerned about faculty pre-existing issues and concerns, and we are developing mechanisms to assess those in an appropriate way. There is a question about retaliation. One thing that I can assure you is that we will be paying great diligence through my office and the Office of Catherine Stewart, Vice Provost of Faculty Affairs, to ensure that there is no retaliation at all for those who request to or ask to teach online. We'll be reviewing the reappointment, promotion, tenure process, post-tenure review, annual evaluation process, and I do not believe that there is a significant risk of retaliation at all, whether it be for a faculty member or a graduate assistant. So good questions, sensitive and important issues, and we're really working hard to accommodate those concerns. I don't know if Vice Provost Schwab, you have anything to add to that.
I think you covered it really well, and especially about the part of the confidentiality of any medical information. Should the situation arise where we need to have that, we absolutely will be sure to keep that confidential. And we all stand ready and available to discuss with anybody if people do feel there is retaliation, and we're prepared to handle any of those concerns.
Okay, Maggie, next question.
Along those lines, we received several questions regarding the university's decision to hold face-to-face instruction. How is the university weighing the competing pressures of providing a traditional on-campus experience for students with health and safety concerns? What factors into that decision? And is the university placing economics ahead of student and faculty health by increasing face-to-face classes?
Provost Arden.
Thank you, Chancellor. I know that once again, as I started out, these are very difficult issues, and there are many competing things that we're trying to weigh up. First of all, our desire for a premium on-campus face-to-face experience. We're committed to that for our students. It's also necessary for the conduct of our research and engagement issues as well. We have to be sensitive to the fact that we're part of the UNC system, and that determines that at this stage that some face-to-face instruction be included. Our primary concern, of course, is the health and safety of our faculty, staff, and students, and we've been working hard all summer to make recommendations and guidelines for how to conduct our instruction, our research, and our engagement in a safe manner. Lastly, it would be foolish to say there are not some economic considerations. The reality is that there are many of our staff throughout the university, thousands in fact, who depend for their jobs on revenues created from an on-campus experience. So while that is there as a factor, and it's a factor for consideration, it certainly is not the predominant factor compared with health, safety, and quality of instruction. We've been working hard to balance all of these issues over the summer, and we can expect that our recommendations are going to continue to evolve as our assessment of this pandemic evolves as well. I don't know if there are other comments.
I think you've covered it well. Maggie?
We had several people ask, how will you decide if and when to reduce campus operations again during the fall semester? More specifically, what are the metrics NC State is using to decide the point at which we will cancel face-to-face classes or activities?
Yeah, I think, let me begin with an overarching comment and then ask Provost Arden and Dr. Kasani to weigh in as well. To a certain extent, some of this is out of our hands. That is, we're committed as a state and as a system of higher education within the state that a single institution has limited authority to shut things down because of the impact, frankly, it would have across the entire system. So we're responsive to the governor and to the system office as well. So just know that while we have certain authorities here, this is one that there will be a system-wide conversation about. And with that, I'll turn to Provost Arden and Dr. Kasani as well.
Thank you, Chancellor. This is going to be an important issue. We know that we're going to have cases on campus. We hope that they are limited and contained, but there is a significant escalation of cases at the moment in the community environment. So we do have to ask ourselves the question, when will we know to reduce campus operations or change direction? There are going to be a lot of variables that we're going to look at. It's not simply the number of cases on campus. It's the clusterings of cases in particular buildings, in residence halls, students absent from class, faculty absent from class, staff absent from class. Dr. Kasani and her team are working hard to develop thresholds, if you will. These are unlikely to be hard and fast numbers. They're likely to be guidelines. But paying attention to this and monitoring closely is an important part of what we have to do, and being willing to change direction appropriately is an important part of what we have to do. I don't know if you have anything to add to that, Dr. Kasani.
I think the only thing that I would add is that this is, in my prior career before coming to NC State, this was probably the hardest question we had to ask, was when to close schools. And it's, unfortunately for us in higher education, it relies on many of the metrics that we don't collect every day. So student absenteeism, meaning we measure student attendance, and faculty and staff absenteeism. And for some of the staff, that's easy to get because they clock in and out. But for many of us, on this call today, we don't clock in and out. And so when we are absent, it may not be noticed or counted, I should say, sorry, will be noticed. But so those are the metrics that we're going to use, but they're hard to gather. And so we're working on systems that maybe we could use either as proxy systems or instituting systems that are easy to institute and collect that information. So it's a tough path.
Well, and as I started the conversation by making sure that we all remember that we're part of a system overseen by the single Board of Governors, I do think it's important for all of you that are on the line to understand that NC State is a very strong voice in that system, and that if we're having issues and we're confident that the right decision is an off ramp, as my colleagues at Carolina refer to it, then I can assure you that's going to be taken seriously at the system office. I just wanted to remind you all that we do report to an organizational structure that has some say in this as well. And with that, Maggie, let me go to the next question.
Several faculty members asked how the university plans to engage faculty, graduate student instructors, and teaching staff in decision-making going forward.
Well, I'll start this, Provost Arden, and then Han started the conversation by, we have a weekly executive briefing session where Dr. Orders and Dr. Kasani and others associated with the operation of the university are meeting to look at data and think about the issues that we face. And we want to make sure going forward that we have faculty and staff voices in that conversation. I think this is an example of an effort to be responsive to some of the faculty issues as we've, and as Provost Arden started the conversation, we have a number of faculty that have been very thoughtful about sending me and other leaders of the university their concerns, and all of that is helpful as we go forward. So let me turn to Provost Arden to address this as well.
Thank you, Chancellor. Faculty input and indeed graduate student input, and we have a graduate student forum this afternoon, and staff input is a critical part of decision making. You know, this is a difficult process, and we've had to, over the last several months, make a lot of decisions, some of them very, very complex, and some of them have to be made very, very quickly. Faculty have been involved in those decision-making processes, either by expressing their views through their department head, their associate dean, the dean, or as the Chancellor mentioned, directly to the Chancellor and I, and we appreciate that input. Nonetheless, I would be the first to say that we could improve mechanisms for faculty, for student instructor, and for staff input. The Chancellor's mentioned at least one of the mechanisms that we're going to be using to do that. I look forward to working with Dr. Keller and the Faculty Senate to look at expanded ways that we can formalize mechanisms for faculty input as we evaluate the situation during the fall and make decisions on whether or not we stay the course or whether we have to change direction, or as the Chancellor said, use the off-ramp. So we have had faculty input, but I believe we can redouble our efforts and do a considerably better job in systemically gauging faculty, staff, and student input as we make decisions.
Thank you, Warwick. I know a lot of this conversation is really about the instructional side of reopening campus, but I want to acknowledge the leadership of Mladen Volk and others in research. You know, one of the great things about the early reactivation of research is we've learned a lot about the issues of recertifying buildings, of making sure that labs are safe, and that that we have adequate policies and practices in place to ensure the safety of all of those that are active in research. And I know, Mladen, you may want to say a little bit about faculty involvement in some of those decisions and the path forward in research.
So we have obviously consulted with all the relevant bodies. We talked to associate deans for research. We talked to University Research Council, and we have representatives on our restart committee out of faculty. And we have been thinking ahead to the fall. And at this point in time, we are planning town meeting sometime mid-July before we possibly move into phase 3. And so everybody's going to get an invitation to participate in that, where we will go over all the details. But so far, we have over 3,000 people approved for work on campus and 69 buildings approved for operations. So things are going well so far.
Thank you, Milan. Maggie, next question.
Our next question is, will students, faculty, and staff be expected to waive liability if they contract COVID-19 during on-campus activities? How is this affected by the lack of control the campus has over student behavior in many social or off-campus situations?
Okay. Yeah, I knew we were going to get here. So to begin with, the first thing, we're working really hard to make face coverings and other social distancing measures and washing hands and everything that we're doing to try to protect our community, a real commitment for a community standard. But we know that we have limited control about the behavior of our students, and frankly, that's not just our students. I mean, we have limited control over the individual behavior beyond campus, and that's something that we have to take into consideration. And so let me I know Provost Arden and perhaps Vice Chancellor and General Counsel Allison Newhart may have something to add to this. So Ward?
Thank you, Chancellor. I think you've covered that point well. I mean, the reality is that there's only so much of faculty, staff, or student lives that we can influence when they're on campus. We know from a lot of experiences that students sometimes engage in behaviors that are a little more risky than we'd like. And I don't anticipate that will stop. I think a big part of this is, as the Chancellor and others have mentioned, going to be education and communication. This really is about our responsibilities, not only to ourselves, but to others in the community as well. And we plan on a vigorous educational program, particularly to the students, to understand that they have responsibilities that extend well beyond the hours that they are on campus. That said, we want to accommodate for the fact that our students will have a broad range of lifestyles. Try to infuse those common themes about community and responsibility, and continue to work with the faculty and the staff as we build a successful fall program. With respect to waivers, it is my understanding that we're not going to expect at this stage any faculty or staff to sign waivers, but I'm going to refer to Vice Chancellor Newhart for that.
Thank you, Provost Arden, and good morning, everybody. Thank you for joining us. I think Chancellor Woodson and Provost Arden summed it up very well. We are working very hard on community standards, which of course will involve a lot of education around what that means. And in order for those to be most effective, we will need all in our community to join this effort. Provost Arden is correct. At this time, we have not been asking faculty or staff to sign waivers as a matter of returning to campus. And we will continue to watch as best practices and guidance evolves on this point.
I think it's also important for us to remember that when COVID-19 is in our community, it's in our state, it's in the nation, it's it's an actively communally transmitted virus. And so I think the most important thing for NC State is to have appropriate policies in place, to have communicated them clearly to all of our constituents, hold people accountable for those policies, and make it a community standard. And it's about all we can do, at least in terms of protecting the institution and the people that are part of the institution from behaviors outside of our purview. Maggie, do you want to go to the next question?
Sure thing. How will the university enforce physical distancing in non-classroom and social settings?
Well, I know Associate Vice Chancellor for Facilities, Doug Morton, and his team have done a phenomenal job of working toward dealing with the issues associated with physical distancing and separation, et cetera. So Doug, let me turn to you.
Good morning, Chancellor. Thank you. So we have been working quite a bit across the campus community. We've set up, the classroom setting has been set up, but that's also associated with the SAS Hall mock-up, which shows how people will move in and out of those buildings. So we're trying our best to limit the amount of face-to-face contact that's incidental. Have one entrance to a building and multiple exits. So you're only coming in one way. When we do that, we want to equip that station with some hand hygiene when we get there. In tally, in libraries and residence halls, we're working to arrange the furniture, and if we cannot physically move it, we'll mark it so that people cannot sit on certain surfaces, and they'll be forced by those mechanisms to socially distance, to physically distance. We also think that the messaging is really important. So we worked with each of the colleges and units to ensure that we can continually run the messaging about being cautious with this virus. So the physical distancing, the washing hands, the face mask, and so on. Those things are run in all of our buildings that have electronic boards. Our buses will be set up. The Wolf Line will be set up so that there's fewer seats to be set upon. There's fewer places you can stand in the buses. All that'll be marked. There'll be sanitizer in those buses as well. And we're also going to work to make sure there's an outdoor space. This is a different thing we're doing, is to put some external space with tents adjacent to the most physically constrained spaces. That might be adjacent to Caldwell Hall on the brick space there. It might be on the Brickyard adjacent to Hill Library. It might be on the Oval adjacent to Hunt and the engineering buildings and textiles, so that students can, and faculty and staff can spill out into spaces that will be out of the sun and out of precipitation. We'll support that with Wi-Fi, electricity, and seating surfaces, again, to support the expansion of social distance. Just a quick reminder, the buildings are not going to be fully occupied. So as we look at those buildings, we got to remember that the classes will be less than half full, meaning that you won't have as many people loitering around waiting to go into class. So we're kind of helping ourselves in terms of the overall loading of buildings, but it'll take a campus-wide effort, the messaging, and again, to provide some outlets for people to get out of the buildings and still be under cover.
Maggie, given the time, do you mind me inserting myself a little bit here?
No, please.
Well, I see some questions coming up that I think it would be important for us to provide some context. I know a lot of you, all of us, are very concerned about the financial impact of COVID-19 on our campus. The good news is the General Assembly has allocated sufficient resources to the institutions so that we're not immediately in a fiscal crisis, and that's a good thing for us. But one thing I want to assure all of you, and I've tried to do this in my communications directly to faculty, we are not approaching this in a punitive way. That is, if we have major issues on our campus, that is, if departments or programs are moving more online than we might view centrally as ideal for the success of our students, we're not going to hold people or departments or programs financially accountable for some of those decisions. It's just not the time during a global pandemic to really think about funding allocations that are punitive in any way. So I think, our approach to this is to try to do everything we can to help you all succeed and stay safe as faculty, and to get our students through this semester where they have the benefit of the amazing talent that we have assembled at NC State. I see some questions, for example, where if you're teaching in a classroom and we've had an outbreak, we've had a number of infections, And we would rely heavily on Dr. Kasani to tell us whether that's a major outbreak, or if it's a couple of students that we've been able to do the appropriate contact tracing on. But there may be an occasion where a mode of instruction for an individual class needs to change because of health reasons. All of these things, we're going to work with the faculty and staff and our graduate assistants to try to manage. But regarding the questions that you have about the budget, we're not going into this assuming that we're going to hold people's feet to the fire and modify the allocation of resources because of people's fear over the virus and because of what we're trying to do to help our students succeed. And I'm really grateful for everything that you've all done to get ready for the semester. I know that there's more work to be done, and I also know that we're likely to see challenges going forward. And we're committed to working with all of you and working with the university and the UNC system to meet these challenges in the best interest of our students and our faculty and staff in the state. And with that, I think we're almost done, and I'm apologize. Again, we'll continue to feed these questions into the frequently asked questions from faculty and make this part of the ongoing conversations going forward. I'm grateful to have you at NC State, and I'm really hoping that we're able to move through this effectively and we get to the other side all healthy and safe.